I'm Dr. Flora Waples, the owner and medical director of Restore Medical Spa. And I am here today to talk with you a little bit about Botox, which is, of course, one of everyone's favorite topics. We'll talk a little bit about what Botox is, what it does, how it works, and what it doesn't do. But before we get into the details of Botox itself, we do need to talk a little bit about the aging process, because different types of processes cause different types of wrinkles, and you need to address the root cause of something if you're going to have a natural and appealing result. So there are 3 different kinds of wrinkles that form in the face as we age. The first type is what we call dynamic wrinkles, and dynamic wrinkles are caused by muscular contraction. So you have muscles underneath your skin that allow you to make expressions, and those muscles, each time you make an expression, are pulling the skin from its normal position, which is uncreased and unlined, into a stretched position. And you do that over and over again, hundreds of times a day for many years. And eventually the skin, the same as a rubber band, starts to lose its snap. The skin starts to lose a little bit of its elasticity. And when the muscles pull it into a certain expression, it ends up getting a crease there and staying there. So the dynamic wrinkles of the face, caused by muscular contraction, are here between the brows. We've all got those, right? Here, the straight lines across the forehead caused by raising the eyebrows. Lines around the eyes, crow's feet, caused by crinkling the eyes, squinting or smiling. And the lines here along the nose, called the bunny lines, which some people have and some people don't. The second type of wrinkles that appear as we age are caused by loss of volume. So in the younger face, there's a wonderful amount of volume here across the cheekbones, primarily collagen and subcutaneous fat. And as we hit our 30s, mid-30s, late 30s, this volume here starts to break down, starts to dissolve. And when that happens, the skin that it's been holding up kind of slumps. And so you get these hollows underneath the eyes, the tear troughs, you get lines around the nose, lines around the mouth. All of these are caused by loss of volume in the mid-face here, which is supposed to be holding that skin up. The third type of wrinkles that occur in the skin as we age are wrinkles which are inherent to the skin itself. The skin, like every other organ in the body, ages, primarily due to damage from the sun, smoking, of course, antioxidizing agents. And as the skin ages, you lose collagen in the subcutaneous skin, and the skin starts to get this sort of fine lines all over it, kind of almost looking like crepe paper. These are caused by intrinsic damage to the skin itself. Now, 3 different processes, 3 different sets of treatment. Dynamic wrinkles caused by muscular contraction, treated by relaxing the muscles. That's what Botox does, and we'll talk more about that. Lines in the lower face caused by loss of volume, treated by placing volume back underneath the skin. And that's dermal fillers. And there's a bunch of different dermal fillers: Juvederm, Restylane, Perlane, Radiesse. You may have heard some of these names. That's a whole separate talk that we're not going to get into today, but generally speaking, lower face, you correct with filling, putting volume back underneath the skin. And then wrinkles that are intrinsic to the skin itself, secondary to the skin being aged and damaged, you treat by reconstructing the skin, which is lasers, chemical peels, or medical grade skincare. Again, whole nother talk that we're not going to get into today, but intrinsic wrinkling of the skin, you treat by repairing the damage done to the skin. So let's talk a little bit about Botox. What is Botox? Botox is a protein made by the bacterium Clostridium difficile, which basically gets in between the nerve and the muscle and makes it so the nerve and the muscle can't communicate. So your nerve sends a message, I want you to contract, the muscle can just ignore it. So in the areas of the face where the wrinkles are being caused by muscular contraction, you inject Botox into those areas, the muscle stops contracting, the muscle relaxes, skin flows back into its native position, wrinkles evaporate. It's a glorious thing. So the details of the injections: Botox is injected with a 32-gauge needle, very fine needle, about 3 times the size of a human hair. People normally compare the sensation to a bug bite or a pinch. You don't require anesthetic for it, although people do like to numb with ice. Some people just don't even bother. The injections last between 5 and 10 minutes, depending on how many different areas of the face you get done and how extensive the injections are. At this point, people always want to ask, well, how much does it cost? And the answer to that is it really depends on the individual. Botox is injected as a liquid, and it's tailored to the strength of each individual person's muscles. So in order to know exactly how much each individual needs in what muscle groups, you really have to have a one-on-one consultation with a professional. Generally speaking, Botox is used for lines here between the brows, lines here across the forehead, crow's feet. It can be used a little bit underneath the eyes. It's not as good as a filler or a laser underneath the eyes, but it does help some with some of these wrinkles. Can be injected into the bunny lines along the nose if you have them. Again, some people don't. Sometimes can be used a little bit around the mouth to help relax some of these lines, but again, filler is really the best treatment for around the mouth. Botox not as good, but it can be used there in some individuals. When you get the injections, for about 15 minutes after the injection, you have these little bumps, little swollen bumps that look a little bit like mosquito bites at the site of each injection. They last 15 minutes, they go away, you can go out, go back to your job, go back to work. There's no downtime associated with this procedure. Over the course of the next 7 to 10 days, you'll see the effects of the Botox coming on gradually. One of the very nice things about it is because it comes on gradually and it comes off gradually, it's often very difficult to tell that you've ever had anything done. The injections will last approximately 3 months, depending a little bit on each individual and how fast your metabolism is. If you get repeated injections and get them on a regular basis, the muscles become weak, they atrophy, and then the injections last longer, 4 or sometimes 5 months, depending on the individual. The other important reason to get the injections on a regular basis is, remember, the wrinkles of the upper face are all caused by muscular contraction. If you control that muscular contraction on an ongoing basis, you take away the cause of those wrinkles ever forming in the first place. So not only does Botox treat the wrinkles that you have, when used consistently, it prevents new wrinkles from ever forming. It's hitting a pause button on the entire aging process, which is fabulous. Now, we always have to talk a little bit about risks, side effects, all of these things. I can tell you they're very rare, but I like to talk about them because people should know. The biggest risk with Botox is that when you inject it, it is a liquid, and liquids can diffuse. Sometimes, again, very rare, happens approximately 1 in every 1,000 people. I've never had it happen to a patient of mine, but it does happen sometimes. Is the Botox will diffuse over to the side into this area of the face where there's a muscle that holds the eyelid up. When that happens, the eyelid begins to droop. Now, this is not permanent. It lasts usually a week in most individuals that it happens to. I won't tell you that it's not annoying, because of course it is, but it's temporary. If this does happen, again, it's very rare, but if it does, there are eye drops that can be used to help lift the eyelid, to stimulate the muscles to lift the eyelid back up. There are also transparent eyelid tapes that apparently are very popular in some Asian communities that you put in the eyelid that lifts the eyelid back up. So there are ways that you can address the issue, there are ways that you can ameliorate the issue, and it does go away relatively quickly. But that's the main risk. Now, how can you minimize these risks? After you get the Botox injections, you want to minimize anything that can cause that liquid to diffuse. So, no heavy exercise for 24 hours, because again, anything that gets the heart rate up, that gets the blood pressure up, is going to push more blood through the area and can push that Botox around. So you want to take it easy for the rest of the day. We generally tell people, don't do anything where your head is hanging upside down. Downward facing yoga, hanging by your heels like a bat, whatever it is. We want your head to stay basically upright for at least 4 hours after the injection. We generally tell people not to drink red wine, not to take any anti-inflammatory medications, aspirin, ibuprofen, because these are blood thinners. Bruising with Botox is very rare because the needle is so fine, but it can happen, and reducing the blood thinners in your diet can reduce the risk of bruising. And that's actually about it. Botox, to summarize, is an agent which blocks communication between your nerve and your muscle, allowing your muscle to relax, temporarily removing any wrinkles which are caused by muscular contraction over time. Used primarily in the upper face, from here up, lasts between 3 and 4 months depending on the individual, with no downtime. And if you want to know more about that, of course you can have a consult with me, Dr. Waples. I'm the owner and medical director of Restore Medical Spa. Thank you for your time.